Is COVID still affecting you? 3-4 years on now. Let's talk to Sarah in Belper. Hi, Sarah.
Hi.
I mentioned it in passing earlier on, but I don't pretend to understand what I'm talking about, if I'm honest. Long COVID.
Yes, long COVID. I've had long COVID since April 2021. I've had to take ill health retirement from my senior academic role at the University of Derby. I have an autoimmune disease. As a consequence, I have psoriatic arthritis from COVID. I have connective tissue disease. I now wear hearing aids. My voice box is damaged. I can't sing anymore. I have chronic fatigue. It's a nightmare. And for those 2.2 million people in England and Scotland to be who have long COVID, 600,000 of whom are like me, have had their lives changed dramatically. COVID is still very, very real and not something that we can pretend doesn't exist anymore. Long COVID is a nightmare, and because people have stopped testing as well, interestingly, in some parts of the country, long COVID referrals are going down, and ME referrals and chronic fatigue referrals are going up because
that's what the assumption is first.
No. Well, people aren't testing, so they don't know. And COVID isn't flu. It isn't a cold. COVID is a vascular disease that can affect any organ. I know people that have had pulmonary embolisms and heart attacks because of COVID. So anyone who isn't taking COVID seriously, anyone who is behaving as though we're over the pandemic, please think about the 2.2 million people in England and Scotland who are living with long COVID, whose lives have been turned upside down.
When you hear, I mean, frankly, me, Sarah, saying things like I just have been, how is COVID still affecting you? Almost as though it's a novelty, like, oh, remember that episode, is it still there? What do you feel as you say, it's not over?
I'm angry, but I don't have the energy to be angry. I'm part of a charity called Long COVID SOS. They're online if anybody, wants to have a look at any of the resources. But it's the people that have long COVID that are having to do all the advocacy. There's no more money has been given for research. £50 million was given right at the beginning when it was first acknowledged. The WHO acknowledged that long COVID exists. And it's awful because what else can I do? There's no messaging. There's no public health messaging. Everybody in the inquiry at the moment says we don't know enough about long COVID, but COVID and long COVID are the most researched diseases ever.
How do I put it bluntly? Do you have hope, Sarah?
Hope for what?
Getting better.
I now have autoimmune conditions that you learn to live with. I hope my chronic fatigue will get better. I hope my voice box will recover. My hearing won't recover. I haven't been able to cry since my first COVID infection in January 2021. And can you imagine? You
haven't been able to cry?
No. And can you imagine going through the trauma of losing your career and not being able to cry?
No.
It's, anybody who, I absolutely understand that people want to get on with their lives, but let's get on with our lives safely and in a way that protects people that are vulnerable, because children, older people, not just people like me who have been damaged by COVID, but other people are really vulnerable. And, I get stared at and sometimes laughed at when I wear a mask. But if I don't, because I'm immunocompromised now, I could get anything. So, it's great if you can, if you want to pretend it's not there, then just think about the people that you care about ending up like me.
What is there now in terms of help for people with long COVID? You say that there's not the right amount of understanding. Are there dedicated professionals just spending their life looking into it? Is it being researched? Are there clinics for your conditions?
Yeah, so this year, the National Long COVID Programme funding was distributed out to the integrated care boards that cover each county. But because of the hole in funding for integrated care boards, a lot of those long COVID clinics and resources have been decimated, really. So there are long COVID clinics, but there isn't a wonder drug, and that's because it causes heart disease, it causes asthma, COPD.
Yeah.
It causes colitis. I know doctors that have lost their license to practice because they haven't been able to recover enough from long COVID. So, there is the knowledge out there, but we need the right people to be listening and understanding what's going on. And all the nonsense in the inquiry at the moment, it's absolutely ridiculous because they're not going to the right people. And I'm sorry if I sound really angry, and I've put a real...
Don't apologise. I mean, I started off by confessing my ignorance, and I feel like I've learned a little just in 5 minutes of listening to you.
Well, then that's fantastic and that's amazing. But anybody who had a really, really nasty cold and still has headaches, or still is really tired, or still can't see, or something, or still something else hurts, then get to your doctor, because you probably have long COVID, and you will only get the support you need if you go to your doctor.
Sarah, thank you so much for your time. Take care.
You're very welcome. Take care.
Sarah's in Belper. I didn't know the half of that.
No,
it's quite sobering, isn't it? Blimey.
It is.
I mean, you imagine any of us who got COVID at some point in that period, but if that had happened and that's where you were now as a consequence.
Sorry. As I say, I think Sarah's making a really valid point now. It's so difficult to be able to categorise long COVID in itself, define it, because the illnesses that can come from long COVID, like she was stating, arthritis and pulmonary embolisms and things like that, and multiple, like she said, autoimmune disease and things like that. Your doctor's less likely to go long COVID, is more likely to treat the problem.
Yeah.
It's really hard to get that banner. I don't think I was shocked about, actually, was the fact, I don't know if this is just my household and my family, but we still COVID test. If someone comes in with symptoms, we COVID test every single time. We have a box of them in the house. It's expected of us because we have obviously ill relatives and things like that. I was just shocked that people still don't do that, I guess.
I mean, I've got a cold at the moment, and have I tested? No.
Yeah, we've not tested for a while, but if either myself or the kids are ill, we don't go near my family that do have immune conditions, because we don't want to give them a nasty cold. But wouldn't it be great
if you did know it was COVID, and then like Sarah was saying, if you knew it was COVID and then you do end up suffering with further symptoms, you can actually go to your doctors and say, I had COVID.
And I had COVID when this started. Yeah. More from Mick.